welcome to our last session of the day. We're sending our happy and positive vibes that next year we will all get to finally see each other in person again. I know we're all missing it terribly, so we're going to just keep our fingers crossed for that. We are going to be discussing how to prepare for this and have a successful time at the 2022 Winter Sports Clinic. So presenting today, we have the medical director, Peter Pacinda, and he is joined by physician assistant and medical team member, Melissa Monkwitz. And they're going to be discussing the efforts of elevation on physical activity and strategies to help overcome these challenges. So we're looking forward to hearing from you guys.
Thank you.
Thank you. So I wanted to start briefly by mentioning something about COVID-19. As everyone knows, COVID-19 has produced a very fluid and changing environment in the ski resort industry and public gatherings over the last year. We've been watching this very closely and working with the local and state health departments and expect the next season to progress with some continued fluidity, but to be in a more positive direction for our event. We at the Winter Sports Clinic continue to work towards seeing everyone in person next year in Snowmass and look forward to that happening. This presentation is something that not so much surrounding COVID, but some of the things that we see affect athletes who come to elevation, both with our event and just with the general public of people who come to vacation in the mountain towns here and go skiing. So it has a good place to start for people who are preparing to come to the mountains to go skiing next year. What we're talking about today is altitude sicknesses. There are three specific types of altitude sickness. The first two being high altitude cerebral edema, or HACE. And we see this rarely in Snowmass, but in elevations above 9,800 to 13,000 feet. Fortunately, Snowmass is about 8,700 feet and it's very low risk. We haven't seen a case of this since I've been doing it. We also have, the next one is high altitude pulmonary edema. Typically this starts to set into people who are at elevations above 14,000 feet. However, it can occur in lower elevations if you have comorbid conditions. This also has not become a problem for the Winter Sports Clinic and isn't what we'll focus on today. Today's focus is going to be on acute mountain sickness. To give you some examples, about 40 to 50% of people who come from a low elevation and sleep above 10,000 feet will experience high altitude mountain sickness. About 25% of people who come and sleep at an elevation above about 8,000 feet will experience that. That is the population that we treat frequently at the Winter Sports Clinic. So a little bit about why this affects our body. Thinner air or lower barometric pressure reduces the body's ability to transfer oxygen from the lung tissue into red blood cells in the body. When you come to a higher elevation, this will cause you to have a decreased ability to participate in and your exercise tolerance will be lowered. Your respiratory rate will be increased. If a person lives somewhere below 5,000 feet in elevation, they will most likely be able to compensate and maintain an oxygen saturation above 90%. But you won't be able to maintain your typical oxygen saturation if you are near 100% or 95%. We don't expect you to maintain that same ability when you arrive at elevation. Fortunately for all of us, human body is an amazing mechanism to compensate and change in elevations. While the acclimatization to fully compensate takes up to 60 days, the body does the majority of its compensation in the first 2 to 5 days after you arrive at elevation. The changes within the body will cause you to breathe more rapidly. It will also trigger the body to increase urination due to alkalosis caused by the increase in respiratory drive. The side effect of this is that it does dehydrate you when you first arrive at elevation for the first 1 to 2 days before your body adjusts. At this point, I will turn this over to Melissa, who's going to talk more about the symptoms and what to expect when you arrive at elevation.
All right, thank you, Pete. And if you want to flip the slides forward, people can follow along a little bit. So I'm going to talk about some symptoms of altitude sickness or acute mountain sickness. So like Pete mentioned, this occurs usually within the first 24 hours. And I think it's just when we all feel sort of yucky, per se. So this is such as we can get a headache, we can have fatigue, we can have insomnia, meaning you just don't sleep well. Some people have nausea, even occasional vomiting. People often become short of breath at rest, and obviously dehydration. So what are these symptoms similar to? I think many of us have experienced this, very similar to a hangover. Or just being dehydrated, not getting enough sleep. So sometimes it's hard to triage these symptoms, but that's what we have to do. As we mentioned, there's other altitude sicknesses, which are high altitude cerebral edema, which is HACE. This has a typical onset of 1 to 24 hours of arrival at elevation. These symptoms are much more extreme. This includes extreme fatigue, people have trouble walking, they have confusion, they have irritability. So again, even more than a hangover, now they appear that they're sort of drunk in a sense. This is a complete medical emergency, and we need to get these people down to a lower elevation. We need people to descend at least 2,000 feet, and this often requires hospitalization. And the other more severe type of altitude sickness, which is called HAPE or high altitude pulmonary edema, has even more severe symptoms, including coughing, severe shortness of breath, trouble walking, fatigue, weakness, hypoxia. Again, this is a medical emergency. We need to get you down to lower elevation, and it requires hospitalization. And again, these two symptoms are very rare. We don't see it very commonly in Colorado. I always think of it, you see it at much higher elevations. So I guess we're lucky in that sense, but it can occur, so we need to be aware of it. So what are some of the risk factors of acute mountain sickness or acute mountain sickness or altitude sickness? So of course, the first risk factor is pulmonary diseases. This includes COPD, which is chronic obstructive pulmonary disease, pulmonary fibrosis, recent pneumonia, pulmonary hypertension, sleep apnea, sickle cell disease, angina or chest pain or chest tightness with activity. So all these symptoms, a lot of veterans do experience or have. This is why we ask that it's very important before coming to Winter Sports Clinic that you check with your primary care doctor to review all your symptoms and your diseases and your medications that you are taking. Some other risk factors include oxygen use. If you use oxygen at lower elevation, we often see that you will require more oxygen use at higher elevation. And this may preclude you from participation. So this is why it's important to review these symptoms, or risk factors rather. Other risk factors include alcohol intake and overexertion at altitude. I think that's pretty straightforward there. Again, another risk factor includes rapid ascension to sleeping at an elevation of above 8,000 feet. As Pete mentioned, Snowmass Village is above 8,000 feet, let's say, and most of us will be sleeping at Snowmass Village. And then the final risk factor is a prior history of altitude illness. So unfortunately, if you felt altitude sickness before by hiking a mountain or a 14er, as we say in Colorado, you're at a higher risk of experiencing that again. And then I'll just move into some treatments of acute mountain sickness or high elevation sickness. So the obvious one, first of all, when you do feel not healthy or not well, have that headache and are nauseous, move to lower elevation. It's as simple as that. The second treatment we often say is you need to get some rest and some sleep. You need to let your body recover because maybe you've overexerted yourself. A third really important treatment, of course, is to hydrate. Hydrate, hydrate, hydrate. We cannot emphasize that enough. And I think you've heard that in some other sessions throughout this week. So always have your water ready and handy. Again, with hydrating, we want to make sure that you're eating. So of course, we always recommend that you eat easily digestible snacks. So just have snacks readily available and handy for you. And of course, with mild symptoms, we can treat those with analgesics, such as anti-inflammatories, such as ibuprofen, Tylenol, just some of the over-counter pain relievers that we're all familiar with. And then I will just mention, of course, at the severe cases of pulmonary edema or cerebral edema, there are some medications that can be used. Obviously, we need to get people on oxygen. We also can use hyperbaric chambers. Some people have to be put on ventilators, and obviously they have to be hospitalized. So again, we just like to emphasize that we really would like you to speak to your primary care doctors before coming to higher elevations, because there are multiple risk factors, and you might need to make some changes in your medications, or at least be aware of these issues that can arise. Now I'll turn it back to Pete to go through some preventative measures.
So knowing a little bit now about what elevation sickness is and that it does affect quite a few of our veterans who come to the event, and knowing how your body works and compensates in the first 2 to 5 days after arrival at altitude, some of the things that you need to do or can do in preparation to come up. One of the best ways to reduce the occurrence of high altitude or mountain sickness is to pace yourself, especially during the first 2 days of the event. Fortunately, our event has been scheduled and set up with some of this in mind. The first 2 days include your travel day, coming up to Snowmass and sleeping there. And then the following day, we do registration. There's no overly exerting physical activities scheduled for the first 2 days. We ask that you try not to push it. I know it's easy to want to go out and do a lot of stuff right when you get there. It's very exciting. But we originally put some of this time in to try to help so that you're more successful on the days that you do have events and you're skiing. As Melissa already mentioned, hydrate. The first 2 days, your body's going to go through the cycle of dehydrating itself, trying to compensate for the lower air pressure. And staying hydrated is one of the things that your body requires in order to prevent you from going into acute mountain sickness. Things that are going to work against you and things to avoid when you arrive is avoid alcohol. It's going to dehydrate you. It also causes the body to breathe more shallowly, and the reaction that the body's trying to compensate doesn't occur when you're drinking a lot of alcohol. Avoid saunas or hot tubs. Anything that's going to cause your body to sweat out a lot of extra fluid is also going to dehydrate you. And as we said already, try to avoid strenuous activity for the first day or two, because you're going to get plenty of that once you start skiing on the slopes. If you're not flying into Aspen and or Snowmass and you're driving, one of the things that you can do, especially if you're driving from quite a ways away, is kind of plan your stops. A lot of people who drive in end up spending the night somewhere along the way. And if in doing that, you end up spending the night somewhere above 5,000 feet the night before you arrive at Snowmass, that will help your body start to acclimatize before you arrive. There are, if you're a returning person or someone who's been to high altitude in the past and know that you have struggled with high altitude sickness, there are some medications that can be given preventatively prior to coming. Unfortunately, for a lot of our veterans, they're on other medications already, and these medications need to be worked out with their primary care to determine if they're safe to mix. Diamox or Decadron are two medications that are frequently given for high altitude sickness, and you need to speak with your physician before you would start either one of those. So that being said, that's kind of what can be done to prevent and prepare. At this point, I'm going to turn this back over to Melissa, who has some more ideas on how to prepare and come into Snowmass for next year.
All right, thanks. So just a couple tidbits. Obviously, before the Winter Sports Clinic, we do send out information for you to follow, but these are some things to think about ahead of time. When you're packing, we recommend you pack a week in advance, meaning put all your stuff out a week in advance. and review it that week. There's some of us who like to overpack, bring too much stuff. There's some of us who like to underpack. So we'll remind you of some important things to bring when you're packing. The first thing is make sure you bring enough medications for about 2 weeks worth. This is just in case there's any delays traveling. Of course, there's snowstorms that can occur. And then most importantly, if you're flying, please put your medications with you, or keep it on your person, keep it on your carry-on. Please do not put them in checked luggage. We've all heard those stories where you lose your checked luggage. It may arrive days later, or it may not arrive at all. And again, when you're traveling, travel with your water bottle. You want to be hydrated. Keep drinking that water. For some medical supplies, for those who use catheters, please bring extra catheters with you. And for diabetic patients, please bring your glucose checks with you. And just a reminder, if you do have any other medical devices or products that you have or that you need, remember that Winter Sports Clinic is not held by a VA, so there may be a delay in getting your supplies, and the supplies and products that you use may be different than the ones that we have here in Colorado. And just some other little tidbits or tips. We always recommend to bring chapstick or lip balm that has sunscreen in it. Obviously bring your sunscreen, sunglasses, or a hat with a brim. Just remember that, at Colorado, we're at higher elevation. The ultraviolet rays are more intense, and we do see a lot more people getting sunburned at this elevation. For your activities, playing in the snow, you want to bring lots of different layers of clothing. We suggest bring polyester layers, wool socks, if you have a waterproof jacket or waterproof or outer layer, water resistance, and also with your footwear, waterproof shoes or waterproof boots or water resistance. And we recommend that you save your cotton socks, cotton t-shirts, all that fun stuff to relax into after you've gone skiing. And then most importantly, as you've heard throughout the week, please do some physical activity before you arrive in Colorado. We want you to increase your cardiovascular capacity to be able to enjoy your skiing and enjoy your activities here. And of course, coming to Winter Sports Clinic, you're already going to bring your good attitude, your sense of adventure, and have a great, successful week. As you know, we do have a medical room, and we wear these red medical vests. So we are here throughout the week to help you and triage any medical issues as they arise. But ultimately, our goal is to keep you on the slopes and keep you out of the medical room so you can enjoy your week and have a great time skiing. And so that's sort of what wraps it up. And we'll open it up to some questions or concerns. And if Pete has anything else you'd like to add.
No, does anyone have any questions, or is there anything in the chat box that has come up?
So I was going to jump in right quick to touch. Oh, sorry, Teresa.
I was just going to ask Pete, before we go into questions, could you, Melissa touched on it a little bit, but I think one of the things that would be nice for the people who have tuned in today is for you to kind of detail a little bit about our medical room, the setup, how it's, how it works, what type of staff we have, that we bring in for that and that sort of thing. Could you do that?
Yeah. So the medical room, we set up an urgent care just for the week of the event. It's staffed 100% by medical staff from different VAs around the country. We have a couple of spinal cord physicians that will be there, a couple of ER physicians, 1 or 2 orthopedic physicians, and a number of nurses who work in every sort of clinical environment that we can find. We have a small pharmacy there of medications that are prescribed, primarily medications we would prescribe in the urgent care setting when we see you. We have an X-ray machine that we bring up. And as Melissa mentioned, our goal is to see people there, treat them, and get them back out participating with the event. We also have some agreements with the local hospital as well as the VA hospital in Grand Junction, who take care of patients that we can't treat or that need more extensive treatment than what we can do in an urgent care type setting. We're available from 7 a.m. in the morning until 8 or 9 at night usually, and then we have someone on call for the rest of the evening up at the event. And so we're able to pretty much take care of anything that comes up. We see on average about 30 to 50 patients a day. A lot of those being follow-ups. Once we've seen them the first day, we try to try to touch base with them and make sure everything's going well and make it as a successful event as possible while you're there. We also help to support the seating team and the ski instructors and all of the volunteers who are registered with the event to make sure that if anything happens, we can immediately intervene as soon as we need to.
Okay, perfect. And I know Melissa was just finishing up and touch base on it, but is there anything else that you would recommend as advice to everybody to help them prepare a year, months in advance to be the most successful in the clinic? And even with altitude sickness, I know hydration is super important.
Hydration is super important. The physical that we have your primary care fill out and go over with you, we've really tailored that physical so that your primary cares will be thinking about altitude and what effects could come and whether you'd be a great participant, or if there's something that they're already concerned about, they'll maybe look into a little bit further before they sign off on you coming. We really try to get everybody involved as much as possible. And certainly, as Melissa mentioned, if you're doing stuff and participating with your rec therapy on a regular basis, you're going to be in a little better physical shape, but we don't want to discourage you from coming because you feel like you need to be in great shape. It's an entry-level skiing event to get people out and get them started and get them involved in winter sports. And we don't want you to just shutter up in your house in the winter and only come out when the weather's perfect.
Okay, and then what about people who are wanting to come to the clinic that may not be feeling well?
So this is probably a question that needs to be addressed by your primary care provider. If something comes up and you feel like there's been a change in your health since your physical and you're concerned about maybe what the effect will have on participation, I would refer you to your primary care who already knows you and is familiar with your medical conditions. That being said, if you have the flu or something the week before the event that could affect your participation for certain, we have seen people who had pneumonia a week or two beforehand, and then they come up to elevation and they experience a reoccurrence between altitude sickness and pneumonia. And that really doesn't give them the opportunity to participate the way they would like to when they come. I have seen in the last 10 years, people come who have never had a problem, and then just out of the blue one year, they just happen to be a little under the weather, or they happen to be a little more dehydrated, and that year they have a problem. And then they come back a following year later and they don't have any problems again. So there's no real perfect prediction that we can use to say some people will or won't have problems. And I've even seen it with non-participants. A few years ago, we had a ski instructor who works at elevation frequently, but Aspen is higher than the resort that he or she was working at, and they experienced some problems with elevation that particular year, but have been back since with no problems. So there's no great predictor that we can use to say this will be the year you have a problem or don't have a problem.
And touching base on that, and Michael, thanks for sharing your story. So with all that being said, Peter, should people come and tell you if they aren't feeling well?
Yes, that's what we're here for. We set up the clinic so that we can try to get people in early before the events start, or at lunchtime, or in the evening afterwards. We want to get you in, we want to get you seen, and we want to get you treated so that you can participate and enjoy the rest of the week and be involved in as many activities as possible.
Perfect. Definitely don't think it's always going to be a negative outcome, because we'd much rather have it get checked out immediately than have you wait a few days, especially if it is altitude sickness, because it only gets worse from there. Thank you guys so much. We cannot appreciate y'all enough. Y'all seriously do a fantastic job, and even working with the staff, y'all are just amazing, and we're so grateful to have you every year and to keep coming back. So thank you. And thank you guys too for jumping on the call, because this is so important to hear, even if it's your first year, you've come a million times, and just to get a good refresher on what's going on. So again, we're going to think happy thoughts that we all get to see each other in person for next year. So go ahead and start hydrating now. so that you're going to be perfect and ready to go. See you all next year. So you guys have a great night. Thank you again.